I wanted to start by thanking Senator Austin and Senator Fonfera and their team for the work that they have done. I've been looking at the whole process and the number of people that have been involved, the various legislators that have been involved, and the number of meetings that have taken place to get us to this point has been nothing short of just saying that it takes almost a village to get us to this point to be able to take care of our state's needs. Madam President, budgets are about our values. Budgets are about what we are going to put our resources into as a state that we value, and then the things that are critical to us as a community and the people who represent the community. I want to share some stories to highlight some of the areas that we have to look at and the ones that we are addressing in this budget. A few months ago, I had the opportunity to go and visit one of the shelters. I try to go and interact with the people who are experiencing homelessness. And there was this woman, and I put this video after she had said that it's okay to put this video. And her story was that she actually had been working for not one, but 2 jobs, non-profit jobs. And she was living in a shelter because she could not afford to be in an apartment. And so first, when I was talking to her and I was trying to understand if they had medical issues and that's why she was there, and because many of the time people are homeless or experience homelessness because of their health. But this woman was not homeless because of her health. She may have had health issues. She was homeless because the 2 jobs were not paying her enough to be able to afford a safe space and an apartment. And her daughter had to live in a different place, and she had to live in the shelter because the daughter was too young for that shelter. So she had to find a safe space for her daughter. And people have this general idea that people make a choice to be homeless. Actually, we are at times making a choice for them as a state, as a priority sometimes that we set up and allow some of the businesses to treat their workforce in that manner. So I know this will remain a challenge, but this is one of the fastest growing segments in our population, the working poor, the Ellis population. If you look at those numbers and look at the trajectory, we will have to address that sooner or later. I know this bill is addressing some of those issues, and we are looking at making sure that the individuals who are providing the best care to the most vulnerable in our state, they are well taken care of. So I applaud the effort, and because within the guardrails that we have so much limitations that have been placed at this point that we cannot achieve what we would like to achieve. But within those challenges, we have done the best, and I wanted to thank both Senator Austin and Senator Fonfera, because I know at every step of this process you have been working to make sure that we do the best with the resources that we have. And you have been very clear how important this is to you. But I feel collectively in this body and the entire body that is in this building, we will have to address this issue sooner or later, because we will have to have interventions to make sure that our population and the people in our state are taken care of. So I'll also thank the committee for making sure there's support for people who are experiencing homelessness. 2 weeks ago, I was in Hartford early morning with a group of Haitian American community members. They were celebrating the Haitian American Day, and then right at the steps of Hartford Town Hall was this woman in her 60s. And she was laying there, and then we disturbed her because she was sleeping there. Her name was Michelle. Michelle was there because she could not find a shelter and did not want to be in a shelter because she did not feel safe. But she had the capacity to be able to work. But in her challenges that she was experiencing with her health, mental health, and substance use, she could not be in that safe environment. And she was somebody who had a life before all this. And now with the money that we are putting in, we are going to be able to provide support for individuals like that so that we can buy enough time and have a support system through some of the bills that all of us have supported to be able to try and change the trajectory of the life of many individuals who go through these ups and downs. I also want to share a story about Cameron. Cameron is somebody who has been an amazing brother and a son, and both his mother Fiona and Isabel, his sister, they are vocal, they speak at different places, and they have been part of the various conversations that we have been a part of in this body and some of our bills. They have testified in many of the bills, because Cameron, after having an injury, an athlete got addicted to opioids because he was trying to take care of the pain, and before we knew it, he could not be without it. And one day he was just taking the medicine that he was able to get on the street, and there was fentanyl in it, and Cameron died. And since that time, his family, as they grieve and they continue to grieve, they are making sure that we have a protection for people. This bill, this budget is going to look at how we can support Narcan to be easily accessible, how fentanyl strips would be easily accessible. These are our children, these are our adults, these are our family members across the state who are experiencing this. Despite every year that we are putting these things in the budget, about 1,500 people die every year. By the end of the day today, 4 more people will be dead. And these are preventable deaths. These people are full of life capacity, are individuals who are capable of making life better for everyone around them. They are loved, they will always be loved, but we can do better. And then this bill is going to put some resources for us to start to look at this. One of the biggest investments that we have done in the recent past in this arena is to have a Narcan fund. And I want to thank the people who have been advocating this, some of the bills from the Public Health Committee that we have pushed for. These are going to be able to help prevent these deaths and get the people who are experiencing these challenges to a better place to go and be in part of rehab. There's again, part of some of the fund can be used for harm reduction centers, which are important part of our support system. In our conversation in the community, there are child care educators right in every community. If you look at East Hartford, parts of East Windsor, they are families who are providing care to the children. And they have been doing heroic work in the last few years, especially during the pandemic, where as the minimum wage has been gradually, thankfully, going up, they have been getting better opportunities to work in a less stressful environment. And as a result, the number of individuals who are providing care as child educators have decreased, and they have to be taken care of. This budget addresses that as well. Care for kids, providing young children educators. We are putting money into to make sure that we provide them the support that is needed. Are we providing support that's going to fix all the problems? No, we cannot. But are we doing enough to be able to provide them support so we can continue to keep this organization and the community alive and well and then move in the right direction? Yes, we are. And then we will probably have to continue these efforts because this is a very important work. This is a nationwide issue, but we are doing more than what most of the other states are doing, and we have to do more. But this is something that I'm proud of, that this has been one of our priorities that we have been looking at. For the towns that everybody at times complains, and myself included, about that we are 169 towns. Each town has their budget. There are school systems in every town, and there's a cost associated with it, and that's part of the reason that an average individual in the state of Connecticut has to pay more, because they are paying for infrastructure in their towns. But the good thing that comes out of this is that we have hyper-local school systems, and they are governed and overseen by Board of Education, who are committed to make sure that the children of that community get the best education. Our job as a state is to make sure that we make them full, complete, so they can provide the best education. So ECS funding that we are providing, and above and beyond what we have done in the past. And this is something that is also something which we should be proud of, that we are going to be able to address the town's one of the biggest, most important needs, to provide them the support so that children can be educated in a safe environment and who will be the leaders of the future. One of the things, even prior to the pandemic, that we were experiencing was that the workforce shortage had been increasing, and the pandemic has made it worse. And that's the reality, and in order to address that, we need investment in the workforce. And this budget is addressing that. If you go to any manufacturing company, I would just even say that go walk to any manufacturing place in the state of Connecticut, in any town, in any community, in any district. They will say we need workforce. And that's why we have to have an investment in the workforce. If you go to any healthcare facility, if you go to any hospital, they will say, we need workforce, we need nurses, we need staff, we need radiology technicians, we need physicians, we need people who are going to be able to provide the care. And we as a state would have to invest in that arena. And this budget is going to look into starting to make sure that we do our share in the manufacturing arena as well as in the healthcare arena and beyond. So this is something is important. Our seniors, they are also experiencing challenges, and this budget is looking at taking care of the nutritional needs of our seniors. And it's critical because if people who go and interact with the seniors and do door knocking, you'd be surprised how many seniors are so close to being food insecure, and they do not have the safety net. And we created a system to make phone calls in our community to make sure how the seniors are doing, so people actually make phone calls on a daily basis to talk to the seniors who are residing alone independently as of right now, but they're literally a fall or an illness away to being in a long-term care facility or a short-term care facility, and we have to make sure that we take care of their nutritional needs and then be a part of their safety net. And this budget is addressing that as well. And I can go on for a little bit. I just want to touch one more thing. Recently, if anybody would talk to some of our ambulance services and the EMS providers, they will tell you that the amount of money that the Medicaid pays for an ambulance is not even enough to pay for the gas of that ambulance. I'll repeat this because it's worthy to repeat. The amount Medicaid pays for ambulance services is not even enough to pay for the gas for the ambulance when an individual needs help with their chest pain or other issues, when somebody is going to take care of them, let alone the workforce that is taking care of this, the driver, the EMTs, the paramedics. We are unable to provide them the support they deserve and we need to take care of so that people make that as their profession. This budget is going to look at in 2025 to put 10% more in the Medicaid payment for that. And that's something that I don't think when was this word said, that what I just said around this circle for how many years, that Medicaid reimbursement for ambulance services is increased. I'm going to say it again because I don't know when we will say this again, but it's worthy to say because we need to say it every year, because that's critical, because we need to have our first responders be taken care of. So, and as I will just mention that despite all of these things, and I can talk about stories about each aspect that's going to touch the lives of the citizens of the state of Connecticut, this budget is addressing that. Is it perfect? No. If we made a perfect budget, somebody would be unhappy, and that would be the people in the state of Connecticut, because they would have to pay far more. Within the responsibilities that we have, this is a very good place that we are in. We are within the guardrails. We are going to make sure that the fiscal strength of our state is sound. We have enough in our rainy day fund. We have enough money to be able to pay down our debt, and we have enough money to be able to help people. Part of that is painful because the working poor issue has not been resolved, but that journey we will have to collectively take together, and I would urge, as I say this afternoon, that this should be one of the top priorities going forward for this body, that because we cannot allow that to continue to happen. So, Madam President, I want to thank you, and I want to thank you for allowing me to speak for a little longer than I should probably have, but it's such an important conversation. It's such an important document. This is one of the most important documents in the entire year that we look at, is the budget. It's about our values. It's about the people of the state of Connecticut, and I stand proud to be able to be part of this body, and my leadership, and who have Senator Looney, Senator Bob, Senator Austin, Senator Fonfara, and all other senators who are working in a bipartisan manner to do the best that we can to take care of the people with the resources that we have. Thank you.